Hi, my name is Bakari Thomas, and I'm a student physical therapist at Andrews University. And today I'm going to be presenting on shortwave diathermy. Is there evidence that continuous shortwave diathermy is effective for tissue extensibility? And essentially, this is a modality. It's a thermotherapy modality that uses high-frequency electromagnetic currents to administer heat into the skin. This heat can be delivered from a capacitive technique or an inductive technique, and the applications for this is pain relief, increased nerve conduction, induction of muscle relaxation and tissue extensibility, and increased blood flow and metabolism. And as you guys can see here, there are the capacitive and the inductive electrodes. The capacitive electrodes, it has like a drum surrounding the knee, and the inductive, there's like a coil that goes around, and you guys see that these are pictures look a little old. This is a modality that is not currently used as much in the clinic, and it's been used as early as the 1940s. So in my first experiment, this was the comparative effects of pulsed and continuous shortwave diathermy on pain. And what they did for this experiment was essentially they put a 13 centimeter electrodes on two sides, on the medial and lateral side of the patient's knee, and they performed continuous and pulsed shortwave diathermy, and the results were collected for pain and range of motion. Regarding tissue extensibility, the research found that continuous shortwave diathermy had more of an effect in increasing knee flexion range of motion than pulse wave diathermy did. One of the strengths for this particular research was that this is one of the few peer-reviewed articles that I found that compared continuous and shortwave diathermy. And also, we know that pain can affect an individual's range of motion, so I do believe it is a strength that they included that in there. One of the weaknesses that the sample size was only 24 participants and the experiment lasted for 4 weeks. However, I do believe that in order to amplify the results for a 4-week period, they could have done 3 times a week versus 2 times a week. And my next one is the effect of heat on tissue extensibility, a comparison of deep and superficial heating. So for this, what they did was they used a deep heating protocol for which is outlined right here with shortwave diathermy. They performed it for 15 minutes, and then they did a superficial heating protocol, which is using a hydrocollateral pack for 15 minutes, and then there was a control group. And then what they found was that tissue extensibility was observed to be more effective in shortwave diathermy than the hydrocollateral pack. And the two strengths of this was that there was a control group that they used, and the individuals being tested were screened for any logical or musculoskeletal problems. And this also was a double-blinded study, so the researchers or the participants were unaware of a lot of the variables in the experiment, so I believe that reduced bias. Some of the weaknesses, however, it was a relatively small sample size, and they did not differentiate between shortwave or continuous diathermy that was used, and the interventions were only performed once, and then the measurements were taken. Okay, so the next one is the effect of deep heating modality on morphological and elastic properties of non-elastic insertional region of the Achilles tendon. And essentially what they did was they took patients or the participants, they administered a 15-minute intervention 3 days a week for 2 weeks. The treatment area was standardized, so they taped it off, and the non-insertional region is right a little bit above the calcaneus, about where the tendon inserts. And essentially what was assessed was tendon thickness, cross-sectional area, and hardness percentage. And the ultrasound and shortwave diathermy protocol were followed respectively, and this was the results. The morphological elastic property changes experienced a larger effect in diathermy than compared to ultrasound. And I believe that the two of the strengths for this experiment was that the equipment measured the thickness in the cross-sectional area of the tendon and also the tendon hardness. These were electronic measurements, and the first one was taken by a procedure called real-time B-mode ultrasound for the thickness in the cross-sectional area, and the second one for the tendon hardness that was taken was something called sonoelastograph, respectively. And these were measured, and unlike range of motion or with you using a goniometry or manual muscle test, I believe that these outcomes were a little bit more precise. However, I do believe a weakness of this experiment, because they were testing the elastic properties, I do believe a weakness of this experiment was that range of motion was not assessed. And in the next experiment, the effect of continuous and shortwave diathermy on the management of knee osteoarthritis was observed. In this experiment, there were 2 to 3 patients with there were patients with grade 2 or 3 osteoarthritis. These patients could not have received physical therapy within the last 6 months or had any knee, ankle, hip, or back pathologies. The sessions lasted for 15 minutes. And then 1 month after, the patients were assessed by something called the VAS pain scale, or the WOMAC, right? And that's an index for patients with osteoarthritis. Both treatments appear to be effective in reducing the scores for knee osteoarthritis with the VAS and the WOMAC scale. I believe some of the strengths for this experiment was that the participants were basically assessed before the intervention and then 1 month after. And the 1 month after, I believe that was a strength because that also assesses the retention of the modality treatment. And then some of the weaknesses that I believe that outside of the continuous or pulsed shortwave diathermy, there was no other form of treatment administered, physical therapy treatment administered. And for the last one, they looked at the evaluation of shortwave diathermy and ultrasound as combined physical therapy treatments for knee osteoarthritis. And what essentially they did was, with group 1, they did a hot pack quad strengthening plus a TENS unit plus ultrasound. And then in the second group, they did all of those same things, hot pack, quad, strength, TENS unit, but they switched the shortwave diathermy. Patients received treatment 5 days a week for 2 weeks, and the outcomes were assessed by the VAS, timed up and go, and they have something called the Lequesson scale, and then also the repetitive sit to stand scale. And I believe that this personal experiment was one of the largest that I came across, with 110 participants. So that was a strength that I noted. And some of the weaknesses is that the use of the combined modalities, so the TENS unit plus the quad strength, plus the hot pack, it makes it hard to isolate which of the modalities actually caused a change, right? But we do see with group 1 and 2, they showed improved VAS scale compared to group 3, but little improvement with the timed up and go, repetitive sit to stand, and the Lequesson index scale. So in conclusion, although this use of shortwave diathermy, continuous or pulse, has shown to have a physiological effect with tissue heating and extensibility and pain relief, I do not believe that I would personally recommend this modality. When I was doing some research, most of the units that I saw ranged anywhere from $5,000 to $11,000, $5,000 on the lower end. This also is a modality that is rather large from some of the units that I've observed, and also it is slightly outdated, so there is not very much peer-reviewed research to support the new findings within this modality. So it is not something I would currently recommend unless a practitioner already had it in their clinic. And thank you guys. These are my references. I will see you guys in class. Bye.